I love my job.
It's very rewarding.
I think the job's rewarding. Like you say, you're getting people to the best place that they need to go. When I did training 2 years ago, it was done over 10 days. So you have like your week of practical plus your theory side of it, i.e. your first aid, your manual handling, e-learning, and then you get 2 days of driving assessments.
Where you do your banksman and your official driving assessment.
But training on a whole is absolutely fine. I always say you don't start your job until you're out on the road.
So we are a patient transport. We're not a 999 service. We are here to assist with in and outs to hospital, to appointments, to transfers if people are going to a community hospital from an emergency hospital. E-zec as a whole have a number of different career paths. We've got up north, we've got emergency care assistants. Down south, we've got high dependency, depending on if you want to do your blue light training or not. Every base, a PLO, so patient liaison officer. They deal with hospitals, they deal with your renals, so that's a good career path from an ACA, an ambulance care assistant.
So basically what we do on a daily basis is we come into work, always do our vehicle checks first.
So our PDA today, we have 12 patients in and out, various different places. We have renals, we've got hospital transfers.
We also do transport end-of-life patients. If you're taking someone from a hospital to go home, you know that's probably their last place they're going to go before they do pass. And it can be really challenging in itself. So it is a busy day, but there is flexibility to grab a drink at some point during our day to have a little time out, whether it be for 5 minutes or a half an hour break, but we should have time. I think it's the communication. Like if we ever have an issue or anything like that, we know for a fact we can ring Sue, we can ring control, we can ring our PTLOs. So yeah, 2 months ago, Shannon went for IVF. It failed, unfortunately. And obviously we came into work literally the next day after we found out we failed. And the support that we had, i.e. from Sue, from the higher bosses, you couldn't ask for anything else. They were so supportive.
Yeah, so I had time off for scans, or I had a later shift so I could go to scans in the morning. I had to have 12 days off after my embryo transfer because I wasn't allowed to do any heavy lifting. Yeah, they were really accommodating and I couldn't thank them enough. Teamwork is massive in this job. Absolutely. You have to be able to communicate, especially with control, with your bosses, your PTLOs. You've got to have a good communication system in place.
Obviously your house is always risk assessed, but until you get there yourself in person, you're always like, oh my God, what am I going to have to deal with? But that's why we have risk assessments.
You can go to a house that may have steps that you didn't necessarily know about. It's all little things. So you need to know if the patient can transfer, so you can transfer them into a carry chair. There's always a way around.
Always a way around. There's no I can't in this job because there is a way around. You can go to some patients and they're just very much like, oh my God, thank you so much for what you're doing for us. You're doing an amazing job. And just little things like that can completely brighten your day.
Absolutely.
It's just the little things that patients do or say that can change your day to be a really good day. I think if I thought about doing this 4 or 5 years prior when I actually started, I would have told my younger self, go do it. Go do it, because the reward you get out of it, the feeling that you get out of it. Yeah, I'm making it sound like it's all easy breezy, fun, and it's not. You do
run into your challenges
on a daily basis, but then you overcome them with your crewmate, with your control, with your manager, with your PTLOs. It's all about making a difference, and I think we help that, and that's an amazing feeling.